Welcome to Advancing Healthcare Through Simulation, the show where we explore the future of healthcare training, workforce development, and the critical role of advancing simulation. I'm your host, Lisa George, and I'm thrilled to kick off our very first episode with a special guest who knows simulation inside and out. Joining me today is John Sutherland, the director of the Center for Advancing Medical Simulation, or CAMS, right here at NAIT. Under his leadership, CAMS has evolved into a powerhouse of innovation, education, and industry collaboration. Today, we'll be discussing the exciting strategic restructuring of CAMS and how it's shaping the future of healthcare training. John, welcome to the show.
Thanks.
So let's start with the big picture. CAMS has been a leader in healthcare simulation and training, but there's been some exciting changes happening at CAMS. Can you walk us through the recent strategic restructuring that's happened and what that means for CAMS moving forward?
Definitely. Yeah, CAMS has been a tremendous leader in this space since 2016 when it opened. NAIT's done simulation in healthcare since even before that, but since the facility itself has opened, there's been some amazing transformations with the state-of-the-art facility, and then different skill sets and levels of expertise joining the team. And so here, even recently in the last year, we've had interprofessional education with yourself joining the team. We've had the biomedical technologists joining the team. We've had sort of a revamp on the simulation technologists themselves and how that team works and functions. And then having to bring all that together so that strategically each of those pieces works together. So we've developed 5 key priority areas. So the first being operations that really make sure that everything flows and runs as smoothly as possible and sort of connects all the dots. So everything from accreditation and making sure that we're living up to the best practices and standards of what accreditation means with the Society for Simulation in Healthcare. Also into budgeting, and then sort of the day-to-day management of the facility and the actual physical space. Then we've got our simulation-based education and training, and that's really the key of what we do and the core business of what we do. So both from an internal perspective, working with the 20 programs across the School of Health and Life Sciences, as well as some health-adjacent programs elsewhere in NAIT, but also externally and working with the simulation-based training that we can do with healthcare professionals, with uniformed personnel, and with industry at large. Then we've got interprofessional education, as I said, with yourself joining the team. And so really building those interprofessional communication skills and the collaboration skills and working together as a team, integrating the patient partner program and having that voice as part of the program, and really sort of tying together how everything that we do involves a healthcare professional at some level. And then beyond that, there's applied research. And so applied research has really grown, especially over the last 3 to 5 years. So it's from a few different standpoints, being internally looking at how effective are the programs that we're running with the internal training, but also externally. So how effective are those programs and how can we prove the effectiveness so that our external training partners can maybe go back to their funders to make sure they've got the funding to continue to do this. As well as from the health innovation services side of things, making sure that we're abiding by the ethics standards and that we're engaging the right type of end users in some of that usability testing and things that way. So applied research has really become like a focal point and a core of what we're doing across CAMS.
It sounds like you really have a strong expertise on the team, very well-rounded. So
definitely.
What happens when you have some of those health innovators come into CAMS and, their background is not in education and they're not, as keenly in tune with those standards that we uphold? How does the team support them?
Yeah, so from the initial onset, there's an opportunity for them to provide a little bit of an idea of what they'd like to do, and so there's an intake form that would help them to kind of outline, this is maybe what I'd like to do in simulation and what I'm thinking, and then that matches up with yourself as our interprofessional education person, but also as our instructional focused person. So really focused on the educational aspect of what we're doing and making sure that really fits on the educational best practices, and that from a teaching and learning perspective, everything is as top of the line as it can be. And then marrying that with the simulation-based education side of things. And so our simulation technologists working hand in hand with the educational side as partners to say the facilitator or the instructor or the educational side of it would provide the the subject matter expertise in what they're bringing to the table. And then our simulation technologists will bring that simulation-based best practices to the table and then match those together to make sure that the simulation itself is as real as possible, as effective as possible, and done at the level of standard that we have to follow through our accreditation.
Hey, yeah. So especially we've had an emphasis on the industry collaboration and applied research. How do these changes position CAMS as a national leader in healthcare simulation?
Yeah, the biggest thing is that there's just a massive lack of literature in the allied health professions overall. And so the opportunity for CAMS to really be a leader in that space and for NAIT to be a leader in that space is essential to what we're doing. And really applied research is really the core of everything that we do. So whether we're working with an industry partner and we need to prove effectiveness of what we're doing with them so that they can look for funding or different ways that they can stay involved in the simulation-based training that we can provide, or internally with our NAIT programs and working with the programs across the School of Health and Life Sciences and making sure that the training is as effective as possible, the students are reaching competency as effectively as possible, and that they're as prepared as possible going into their clinical placements and beyond.
So one of the biggest challenges in healthcare today is the workforce shortages that we're seeing. CAMS is at the forefront of addressing these issues through simulation-based education. Can you break down how CAMS is bridging that workforce gap and helping prepare healthcare professionals for the real-world challenges they may face?
Yeah, so there's a couple of ways. First of all, through the accredited processes and meeting the standards required through accreditation on a global basis. So making sure that the simulations are standardized and that the students have a standard level of learning and experience, and so they can practice and train and repeat. And then from a research perspective, looking at things like simulation to replace or supplement clinical to offset some of those clinical bottlenecks or shortages in the workforce right now. And so it's getting more students in more placements, but also helping to offset some of those placement restrictions or bottlenecks to whether that's enhancing the number of seats that are in the program based on being able to get more students through the program, or just getting more students out into the workforce using simulation as basically leverage to do that.
Right, and there's a chance they may not experience certain cases or exams, in their training, right? So I think this might give an opportunity to fill those gaps as well.
Yeah, based on being able to provide that standard level of experience and making sure that the competencies are met that they're expected to meet during their clinical placements. It's an opportunity to make sure that each of those things happens, whether they're in a rural setting or in an urban setting, they get that consistent experience, and simulation can provide that consistency.
Yeah, that's great. Yeah. Now let's talk about something we're both really excited about, the Advancing Healthcare Through Simulation Summit happening May 7th. Why is this event such an important milestone for CAMS, and what's the broader healthcare and education implications?
So the big thing for CAMS is that it's an opportunity to really explain who we are, what we do, and why we do it. And so it's bringing together really the three focus areas of what we're working on. So the first part of it is around simulation-based education best practices. The second part of the day is around workforce development and how that's enhanced through simulation. And then the third part of the day really ties it together as far as advancing health innovation through simulation. And so I think people really understand the teaching and learning side of what CAMS does and how that would work with our students. I think there's kind of an obvious next step to, if you can train your students internally at NAIT, you can probably provide training for an external market of healthcare professionals, uniform personnel, or industry. But where the disconnect tends to come in and where some of our maybe market confusion is how the heck does CAMS provide healthcare or health innovation services? And so what we'd like to do is showcase how, based on the core of what's developed in the simulation-based education best practices, and really being an accredited center and following those global best practices to provide the best simulation-based education training possible. That allows us to get into that workforce development and into the external training that we do, and that external training community that comes together. So the different groups that utilize us for external training are really the type of groups that health innovators would want to have their products, services, and solutions in front of. And so with our state-of-the-art center, with the expertise that we have within the simulation-based education side, as well as the applied research side, and our interprofessional education, we can bring together that community to enable end users to actually, touch and play with and try to break those different health innovations and really getting it into those end user hands so that the health innovators can get that early feedback that they need so they can develop the best medical device or digital health technology that's possible to bring to market.
Yeah, so tell us a little bit more about what that might look like in CAMS. We have the spaces that can look like a hospital, but is there ways that you can change the settings to meet the needs?
Yeah. So it's 6,000 square feet of immersive space, traditionally set up as clinical space, but we're able to provide a home care setting. We can provide industrial settings. We can provide workplace settings, as well as outdoor settings. We've got 9 different simulation theaters, plus the waiting room that can act as a theater, and an ambulance box, and a driving simulator. So really, depending on what the training need is, or what potentially the health innovation need is, there's ways to turn the center into whatever it is that you need, so that it's got the correct environment, using the correct modality, and then engaging the correct, whether it's end users or simulated participants or whatever we need to do to bring in that environment to make it as real as possible, so that from a student learning perspective, they're getting that realistic perspective, or from a health innovator's perspective, they're getting the end users that will actually utilize their product one day to provide them that early feedback in the actual setting that it would be in.
That sounds great. I know that one area in particular in CAMS is always really exciting to see in use is that immersive 360 theater. What does that look like, and how is it being used?
Yeah, the big thing is that can be honestly anything. So at this point, we've got over a dozen different scenarios that can be involved in there, a dozen different environments that can be involved. And so there's things like a campus bar, a rave scene, wilderness setting that could be camping or things that way. There's the ability to pump in smoke, smells, change the temperature. We've got a helicopter landing with the military that the industrial fans will kick on as the helicopter comes in, makes it as real as possible, and the medics need to secure their pack as the wind's blowing and that sort of thing. There's a mass casualty incident that's run in there that is a building collapse, and so dust, debris, chaos, all sorts of things going on with sounds, lights, the temperature and the smoke and different things that way. So really it makes it as real as possible and really immerses the students or the training partners or potentially a health innovation testing ground. It engages them right in that actual environment that they'd be in. So you really enable all 5 senses as you're involved in a immersive setting like that, and it makes it as real as possible.
That's incredible. You could really make it anything that you need then.
Definitely.
I love that CAMS is not just about the training, but also empowering healthcare professionals and really preparing them for those real world situations. So can you share a story of a successful student where maybe they provided some information where we had a measurable difference?
Yeah, I'd say there's a number of things with CAMS offering such real, such high fidelity simulations. The experiences are extremely real, and the level of mental engagement and often stress is extremely real. And so there's things like paramedic students needing to help a caregiver or a guardian to allow basically accept care for their child. And so there's things that way that if they go through that communication process and have to learn how to navigate that situation and communicate with that caregiver or guardian so that their child is able to be cared for. If they're doing that in CAMS in a safe space where they can remove themselves if it gets too stressful, or they have the opportunity to go back and try again and practice again, maybe even make their mistakes with us rather than on the road, then once they are out in the real world and they're working with actual patients and actual humans, then they've got an opportunity to have learned that and felt that and have experienced that before. And so it's not the first time and sort of a shock. You have the shock within CAMS and have an opportunity in a safe place to deal with that and process that and work through it and practice it.
Feeling much more prepared, I imagine.
Definitely, that's the goal for sure.
Yeah, that's great. Well, John, it's been an incredible conversation. Thank you so much for joining us on our very first episode of Advancing Healthcare Through Simulation. It's great to see that the next generation of healthcare professionals is truly being, shaped through innovation within CAMS. And thank you again for joining us today, John.
Thanks very much for having me.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.